Welcome to Small Business and Employee Health, the Small, Safe, Well Study. We're glad you're here. My name is Yusra Benjeloun, Office Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. The webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct link for all of these items when they're available. As I mentioned, my name is Yusra, and I'll be moderating the webinar and Q&A session. Our presenters today are Natalie Schwatka and Erin Shore. Dr. Natalie Schwatka is an assistant professor in the Center of Health, Work and Environment at the University of Colorado. She's also involved with several total worker health initiatives, including the development of total worker health leadership training for small business leaders, evaluation of a total worker health intervention for small businesses, and the evaluation of the value on investment of a workers' compensation insurer-driven worksite wellness program. At the Center for Health, Work and Environment, Dr. Schwatka continues her work in the field of safety leadership as a co-investigator on a Center for Construction Research and Training grant to develop and evaluate an OSHA 30-hour safety leadership module. She's also the Associate Director of the Mountain and Plains Education and Research Center Occupational Ergonomics and Safety Program. Erin Shore is a professional research assistant for the Center for Health, Work and Environment. She conducts research for projects including program evaluation and occupational health and safety. Erin earned her MPH with a concentration in epidemiology from Emory University. She also has a Bachelor in Science in Health and Exercise Science from the University of Oklahoma. And now I will hand it over to Erin.
Thank you, and thanks everyone for tuning in. We are going to be discussing the Small+Safe+Well Study, which is a NIOSH Center of Excellence Small Business Total Worker Health Intervention Study. Just to give everyone an overview of what we're going to be talking about today, we're going to briefly talk about who we are at the Center for Health, Work and Environment and what we do. We're going to introduce you to the concept of total worker health, and then we'll give you an overview of the Small+Safe+Well Study, or the SWELL Study as we like to call it. We'll talk about the study process, which includes health links, the Employee Health and Safety Culture Survey, a Total Worker Health Leadership Program, and then we'll briefly touch on the study progress to date and future directions of our research. So we are the Center for Health, Work and Environment. We're housed at the Colorado School of Public Health, which is on the Anschutz Medical Campus in Aurora, Colorado. We are one of 6 centers of excellence for total worker health, and we also house the Mountain and Plains Education and Research Center, where we train and educate future occupational health and safety professionals. We use a total worker health framework in everything that we do, and we really strive to advance worker health, safety, and well-being with our education and research. We wanted to acknowledge the other members of the Small+Safe+Well team. We couldn't do this work without them, and also our funding, which comes from NIOSH, which is the National Institute for Occupational Safety and Health. So to briefly touch on total worker health, when we talk about health, safety, and well-being at work, we're generally talking about 2 things. So there's safety or health protection, which includes injury prevention, hazard awareness, training, return to work, things of that nature. And then there's also wellness or health promotion, which is benefits, paid time off, employee assistance programs, health screenings, things like that. And at the Center for Health, Work, and Environment, we like to think of these two areas of health together. So it's hard to be safe at work if you are sick or ill, and it's hard to be healthy at work if you are worried about being injured. And so the concept of total worker health is formally defined by NIOSH as the policies, programs, and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts to advance overall worker well-being. And another way to think of this too is kind of in contrast to the traditional view of occupational safety where the worker goes home from work in the same condition that they arrived at work in. Total worker health takes it a step further to say that the worker should go home from work in a better condition than when they got there. And not only is total worker health good for the worker, it's good for the business as a whole because employees are more satisfied and more productive if these 4 core needs are met. So physical needs incorporate things like injury, pain, chronic health conditions, kind of more traditional health and safety items. But they also workers need their emotional needs to be met, which are things like support and appreciation. Their spiritual needs need to be taken care of, and that is meaning and connections at work. And then also their mental needs need to be taken care of, which are things like focus and control and stress. So now that you kind of have an idea of what total worker health is, I'm going to toss it over to Natalie to give you an overview of the SWELL study.
Awesome. Thank you, Erin. So Erin and I are going to bounce back and forth during this presentation. And before Erin gets into the details of what's involved in our Small+Safe+Well study, I thought I would just set the stage for the general purpose of what the study is, and we'll go from there. So our Small+Safe+Well study, like Erin mentioned, is a NIOSH-funded total worker health project. And the purpose of our study is to understand what small organizations are doing to support the health, safety, and well-being of their workforce, but also in terms of their policies and programs, but also to understand how their employees perceive these policies and programs, i.e. their safety climate and their health climate. And ultimately, we were interested in understanding how these health and safety and well-being policies and programs and health and safety climate, how changes in those elements ultimately impact the safety and health of workers. So why small business? This graph that I have here is from the U.S. Economy, and it shows the number of establishments as well as the number of employees by establishment. And just to orient you, the blue bars represent the number of establishments, so the number of businesses. The red line represents the number of employees. And the horizontal axis represents the size of establishments, the number of employees ranging from 0 to 4 are micro businesses, all the way up to really large businesses with more than 500 employees. So as you can see, at least in the United States, we are really a nation of small businesses. The majority of businesses in the U.S. have 0 to 4 employees. Relatively few of them have more than 500 employees. The red bar shows you that, it makes sense that a lot of employees are actually employed by these larger businesses, but we still have about half of the workforce employed in businesses with fewer than 500 employees. So when we were developing the study, we knew the statistic, and we knew that there was a huge opportunity for us to help understand how to do total worker health in small enterprises. And since this isn't just a webinar in the United States, I wanted to just make it clear that, I think if you go in any country around the world and you ask them the breakdown of their size of business, you'll find that they're too made up of small businesses. So the statistics I pulled from Canada, and it just shows that indeed many of the businesses in Canada are small businesses. So when thinking about total worker health in small businesses, there are some opportunities and there are some challenges. In terms of challenges, we know that smaller businesses have higher injury rates, especially in some specific industries. And we also know from our work here in Colorado with small businesses, they have high levels of poor health. we did a small business study with 300 employers in the state in partnership with a local workers' compensation insurer. And what we found was that many of the 16,000 workers that were in our study had chronic health conditions. They had behavioral and lifestyle health conditions, and so there's a clear need to address health in this population. We also know from our public health practice work with small businesses that they have good intentions, that they want to be able to improve and enhance the health of their employees, but they lack the resources in-house in terms of time, knowledge, expertise, money, whatnot. But there are also some opportunities. So in our work, we've also noticed that it's often easier for smaller businesses to change. They have smaller networks, smaller bureaucratic structures, and so if they want to do something for total worker health, chances are it'll be easier for them to implement it than larger businesses. In our work in Colorado, we've actually observed higher employee engagement in health promotion programs in small businesses. So that study I mentioned earlier with the workers' compensation insurer, we actually just published this last month in a special issue of the Annals of Work Exposures in Health. And what we found was that our small employers with less than 50 employees, 70% of their employees were engaged in the worksite wellness program, whereas 20% of employees from large businesses with over 500 employees were engaged in the program. So kind of if you build it, they'll come in the small business context. And finally, we know that small businesses are really relationship focused, family owned and non-family owned. And so those are just some of the challenges and opportunities in working in small business. So we have a couple of theories that we're relying on for our small business study. The first one is Burke's multi-level model of safety. It just argues that worker health, safety, and well-being is a product of their working environment. So you have to consider the upstream factors that influence how healthy and safe a worker can be at work. The second model we draw upon is another Burke and Litwin, and their model of organizational performance and change. And Burke and Litwin focus on two types of change: transactional change, which is just changing things like policies and procedures, sort of the management activities of the organization. And transformational change represents sort of that cultural change, or changing the vision and the way that work is done. We also draw upon the traditional leadership theories from the management literature, integrating them to understand how to create total worker health leadership, which I'll get into a little bit later. So we have a couple overarching hypotheses for our small business study. The first one is that successful total worker health interventions improve and maintain total worker health best practices in small enterprises by promoting both transactional and transformational change. So we would argue that any total worker health intervention in a business needs to attend to both sort of the management structures, but also the leadership structures as well. And a high dose of a total worker health intervention, in other words, one that promotes transactional and transformational change, will result in improved organizational behaviors, as well as improved organizational climate for safety and health. So not only will a business improve upon their policies and programs to protect and promote employee health, but employees will perceive that they are valued and supported in practice. And finally, at the end of the day, if we're successful in helping the business undergo organizational change, we believe that these will impact worker health risk factors, injury rates, and their personal health. So we recently published our framework for our small business study. I have the reference for it on the screen here. You can look it up. It's freely accessible. And in the paper, this is some figure or conceptual model that we use to explain our small business study. As you can see on the top, our total worker health intervention is displayed. We are testing 2 doses of the intervention. The low dose is our program called Health Links, which Erin will explain in a minute. That helps promote transactional change. And our high dose is Health Links plus a total worker health leadership training program to promote transformational change. So our first aim of our study is to just look at at the business level or the organizational level, what's the relationship between the quantity of total worker health policies and programs and organizational climate? So under total worker health policies and programs, we're measuring a number of things that the business has to promote and protect employee health, including organizational supports, health policies, safety policies, et cetera, and Aaron will go into these in a minute. And in organizational climate, we're measuring safety climate as well as health climate, and we're intentionally measuring them separately so that we can see how both types of climate are related to each of those total worker health policies and programs. And again, just to reiterate, climate is really that gut check between whether or not the policies and programs are actually used and supported in practice. The second aim of our study is to understand the effect of our intervention. So do businesses who go through health links and who go through the total worker health leadership training improve upon their policies and programs as well as their climate compared to businesses who just go through the health links program? Ultimately, our third aim is to test how these changes impact worker motivation, their safety and health practices, their own health, as well as their productivity. So we're measuring a whole host of worker-level outcomes and testing whether or not our intervention and ultimately the organizational change impacts worker health and well-being. So with that, I will turn it over to Erin, and she'll take you through the details of what I just went over in high level.
Yes, we're going to spend some time now going through each of the components of the SWELL study. So this is kind of a big picture overview of our small business study. We have an organization agrees to participate, and then the first thing they do is health links, which is composed of the business assessment and advising sessions. And then we have them administer the health and safety employee culture survey, and then they will take the total worker health leadership training and then re-enroll. This is a multi-year project, so we work with these businesses anywhere from 3 to 4 years depending on when they enter into the study. I'm going to go through each one of these in a little more detail now. So first we're going to talk about Health Links. Health Links is a mentoring program that champions health and safety at work. And through Health Links, we offer organizations an evidence-based healthy workplace certification and advising services to help them achieve their total worker health goals. A little bit of background on Health Links. It was a grassroots initiative that was launched in 2013 in Pueblo, Colorado with their Chamber of Commerce. It was also started with a philanthropic gift from Pinnacle Assurance, which is a workers' compensation insurer here in Colorado, and that is how we got started. The Health Links approach is, as I mentioned, it's a comprehensive certification and advising program, and when we begin with an assessment. So we assess organizations will take our assessment to benchmark their efforts to date, to identify critical next steps and to get certified as a healthy business. Next is advise. So organizations complete personalized virtual advising sessions and work with their advisor to develop a healthy workplace action plan that really is kind of their guidebook for the year in terms of their goals and how to meet those goals. And then last is to achieve. So we give organizations access to proven tools and trainings, they get certified, and we try to help them achieve excellence in health and safety. So Health Links, as I mentioned, benchmarks organizations' health and safety programs and policies, and we do that with 6 different benchmarks. So we have organizational support, workplace assessments, health policies and programs, safety policies and programs, engagement, and evaluations. Those are our 6 benchmarks, and I'm going to go over each one of those in a little more detail. So for organizational support, this is really a question of how well do your leaders support team members' health and safety, and what resources are dedicated to promoting health and safety. So do organizations offer paid time off? Do they have paid parental leave? Is there time dedicated for staff members to participate in health and safety activities? Is there space available for these activities as well? Things like that go into the organizational supports benchmark. Next, we have workplace assessment. So this is what kind of activities organizations have to complete to understand team members' needs and interests in terms of health and safety. So things that go into this could be an employee needs and interest survey, or a culture survey that we offer through the SWELL study, healthcare claims and costs, things like that. It's really trying to see if the organization is asking their employees what they want to participate in and what they would like to see. Next is health policies and programs. So what types of programs and policies does the organization have in place to support and encourage health and well-being? Do you have a tobacco-free workplace or have tobacco cessation programs in place? Do you offer an employee assistance program? Do employees have flex time for physical activity, or flex time if they have a sick relative or sick kids, something like that? Is there a healthy meeting policy? Do you have standing meetings, walking meetings? What kind of food do you bring to meetings? Things like that are all in this bucket. So for safety policies and programs, this is what types of programs and policies an organization has to promote workplace safety. You know, violence and harassment and prevention training. Have you eliminated hazardous materials? Have you ever done an ergonomic assessment? Is there an emergency preparedness plan? Things of that nature fall into safety policies and programs. And then we have engagement. So to what extent is your organization being inclusive with health and safety offerings? And do you offer it to your employees' families or the community at large? Do you tailor meetings to your audience? So if you have, an office staff and then a field staff, are your programs and policies tailored to both of those audiences? And are your activities only accessible to full-time employees as opposed to part-time or contracted workers? And then do you extend any offerings to the community members beyond just your employees? And then finally, we have evaluation. So what steps does your organization take to measure the impact of health and safety initiatives? So after you put on a program or something, do you ask your employees, how did you like that? Why did you participate? Would you be interested in participating in the future? Things like that. And really getting at using data from these workplace assessments to inform your future policies and programs. So now that I've gone through the benchmarks, I'm going to take you through the HealthLinks process. So it begins with the assessment. So this is an online assessment that takes about 35 minutes to complete. One person from the organization completes it, and we have a checklist of all the materials you would need so that when you sit down to take it, you can be prepared. And the benchmark is comprised of questions that are focused towards the benchmarks that I just went over, and they were all adapted from the CDC Healthy Workplace Scorecard, the World Health Organization Healthy Workplace Model, and then informed by our own research and practice. And once you complete the HealthLinks assessment, you get immediate feedback. So this is a sample of what our report card looks like. And organizations get this immediately and can see how they scored within each benchmark and then how they scored overall. And then once you get this report card, you'll be recognized as a healthy workplace. And we have 4 levels of recognition. So we have our Kickstart level, Certified, Partner, and Leader. Everyone that does the assessment gets recognized as a healthy workplace, and the level just kind of depends on how mature your policies and programs are. And then last, we have advising. So once you do the HealthLinks assessment, we have advising sessions with our trained advisor. These are all virtual advising sessions, and you formally review your results on the Healthy Workplace Assessment. So the advisor really works with you to explain the assessment if you have any questions, and then goes over the benchmarks and kind of why you might be scoring as you are within each benchmark. And they work with you to identify areas, priority areas, and help you to create actionable goals. And through that, they develop a healthy workplace action plan, and also through Health Links and the advising session, they can guide you towards proven resources and tools that will help you meet the goals that you want to achieve. So the next part of the SWELL study is the Employee Health and Safety Culture Survey. So we'll spend a little bit of time going over this. The overall goals of the survey are to hear directly from the employees. We want to know what their perception of their organizational environment is, and that includes their health and safety climate. So for the implementation of the survey, it is online. We can do paper upon request if businesses want that, but generally it's online, and I work with our main contact and I send them the link to the survey, and they forward that on to their employees, and it's available for 2 weeks for them to take. It is available in English and Spanish, and once the survey is closed, we generate a report that summarizes the results and send it back to the businesses so that they can see what their employees are thinking and feeling about their overall environment and their health and safety environment. And we have a minimum threshold of like number of surveys that need to be completed in order to send the report back to the businesses, really trying to protect the anonymity of our participants. And then, yeah, I'll go over the details of the survey over the next few slides. So we have a few different kind of categories of questions, the first being the general organizational environment. And this is made up of 6 different constructs. So we have organizational commitment, and this is an employee's emotional ties with their organization, primarily through positive work experiences. And then next we have organizational support. This is an employee's perception of the extent to which the organization cares about its employees. The next one is supervisor support. So this is an assessment of an employee's interaction with their own supervisor, and that's in terms of emotional support, helpfulness, information sharing, and performance appraisals. The next category is social support. This is an assessment of the degree to which an employee's job provides them opportunities for advice and assistance. We have job satisfaction, which is an assessment of how much employees enjoy their job and how well and whether they feel they are suitably rewarded for their efforts. And then the last one in this category is work-family balance. So this is an assessment of whether employees feel they have adequate balance between their work demands and their family demands. The next category is the safety-specific environment. So this is made up of 4 constructs. First, we have leadership commitment to safety. This is an employee's perceptions of the extent to which organizational leadership supports safety at work. Next, we have safety climate. This is perceptions around the organization's value for and commitment to employee safety. But next we have safety motivation, which is the motivational reasons as to why an employee is or isn't participating in safety programs. And we measure this in a few different types of motivation. So there's intrinsic motivation, identified motivation, and external motivation. And then we have safety behaviors, which are actions taken to comply with safety rules and to proactively participate in safety programming. And then the next category is the health-specific environment. This is going to be really similar to the safety-specific environment. We have leadership commitment to health, which is an employee's perception of the extent to which organizational leadership supports worksite wellness and health at work. Health climate is the perceptions around the organization's value for and commitment to employee health. We have health motivation, which is motivational reasons as to why employees are or are not participating in health programs. And then we have health behaviors, which are actions taken to proactively participate in health programming. So next, I'm going to give it back to Natalie to discuss the Total Worker Health Leadership Program, which is the third component of the SWEL study.
So our leadership program, if you remember from a few slides ago when I was talking about our conceptual model, the leadership program is part of our high dose of intervention. So Erin just walked through everything related to health links, which helps businesses promote transactional change that helps them change their policies and programs around health, safety, and well-being. And businesses who are randomly assigned to our high dose of intervention also participate in the leadership program. So our leadership program, I'm sure many of you have been through a leadership program before and know about them. There are a variety of ways to do leadership programs. The way that we're doing this is we're trying to understand business leaders' current approach to total worker health, as well as help them identify their leadership actions that they can take to enhance their business's approach to total worker health. So our leadership program is focused on the small business owner. I've been involved in other leadership programs, especially in the construction industry, and our target audience has been mid-level management or the foreman level, the supervisor level, which is an important audience to train in leadership for health and safety. But at least for our small business study, where we're trying to help small businesses undergo organizational change, we felt like our target audience for the leadership program needs to be a key decision maker in the business, which in some cases is the owner or another senior manager. But we found when we were pilot testing this program that while we just wanted that owner or senior manager in the training, we found that they could also benefit from having a colleague come to the training. And so in our pilot study, a construction company owner actually had his safety manager come, and it just worked out fabulously, and they were able to work together during the training to understand what their business's approach to total worker health was, and for them to work together on what leadership strategies they need to take to improve their business practices. So again, our leadership program is targeted at top management, but they're allowed to bring a colleague if they so choose. But we're sticklers for making sure that an owner or senior manager does come to this training. So our leadership program, this is our process displayed on the screen. It's a multi-month program that involves assessments and in-person work and virtual work. So what happens is, once they sign up for one of our leadership program cohorts, I should say the cohorts are pretty small. So we enroll only up to about 20 people, which is about 10 businesses, to come to the training, because we want that intimate experience where everyone has an opportunity to talk and speak and interact. So throughout the study, we're holding multiple cohorts. So once they're enrolled in their cohort, at month 1, they are sent all of their assessments, the Health Links assessment, the culture survey, and they're also asked to take another self-assessment. And they spend about an hour reflecting on these assessments and thinking about their businesses, resources, and opportunities and challenges and barriers when it comes to total worker health, so that by the time they come to the in-person training, they're primed and ready to begin thinking about total worker health leadership in their business. So at month 2, they come to a 1 full day in-person training that's led by faculty from our Colorado School of Public Health and Center for Health, Work, and Environment. It's a 6-hour training that's very interactive, and it takes them through their assessments. It's very much focused on goal setting and helping them at the day of the training think about transferring what they're learning to their job. So we're very focused on behavior change and helping them change after the training. And then for the next 3 to 5 months, they undergo a couple of varieties of training transfer activities, which I'll go over in a second. But the 2 activities are designed to help them actually start to make some changes with our support. So our program is very much data-driven, and this is something that we've found that the businesses, our small businesses, really appreciate because they've never gotten access to this kind of data before, and so they found it really valuable. And the first piece of data that they get is on their business policies and programs, and that's done through the HealthLinks Business Assessment, which Erin went over. It scores them in each of those 6 benchmarks. And then it helps them identify areas for opportunity for improvement. And so the business can see their business assessment results in the training and receive advice on how to set goals to improve that score. They also get access to the Employee Health and Safety Culture Survey. So essentially what their employees say about their work environment in general and as it relates specifically to health and safety. This piece of the data is actually the piece of data that they find most useful and most fascinating during the training. Just the opportunity to hear from their employees, and sometimes it will confirm things that they had been thinking about, and sometimes it may be a surprise. So they've appreciated getting this perspective in the training as well. And finally, since this is a total worker health leadership training, we felt like in our total worker health leadership training, it needed to focus on, obviously, the health and safety of their business practices and their employees, but also themselves, on the theory that it's hard for them to be effective total worker health leaders if they aren't first taking steps to take care of their own health and well-being. So before the in-person training, they have to take a health assessment, and they also take an assessment of their leadership skills around total worker health. And then during the training, like I mentioned, they get to see all of this data and work through some goal-setting processes to improve in each of these areas. So in the 3 to 5 months after that in-person training, they participate in a number of training transfer strategies. The first one is virtual coaching, one-on-one virtual coaching, and they can participate in up to 3 of these virtual coaching sessions, which are 30 minutes each. And it's focused on the goals that they set during the training. So we have a whole training transfer guide where they're actively circling and setting goals for themselves. And during the coaching session, we go through these goals, talk about some challenges that they have encountered, some opportunities, and plan action steps for the next time. We also have licensed a really cool social goal-setting platform that's specific to our Total Worker Health Leadership Program. The goal-setting platform is online, and they basically sign in and they select some pre-made goals that we've created, and then they can actually set the stakes for their goals, so they can put money on the line that if they don't report on their goal progress within the specific amount of time, they'll get dinged and their money will go to either a charity, an anti-charity, or a friend or a foe. And it's also social, so they can find each other on the platform and comment on their goals and just engage in it socially. So with that, Erin's going to give you a little update on some of our study progress so far.
Yes, so to date, we have had 72 organizations enroll in the study, and we've had 59 complete their HealthLinks assessment, which is the first step, and I'm still working with a few other people to get their HealthLinks assessment complete. And then the next step is the Employee Health and Safety Culture Survey, so we have sent out 51 of those, and then we've had 27 leaders attend the leadership training. And so just so you're aware too, you have to have completed the HealthLinks assessment and the culture survey in order to be eligible to enroll in the study. And then we also have randomized businesses, so some of them aren't eligible to do that until they have done both of those things twice. And then we also have been retaining businesses at a very high rate. So I think right now we have 18 businesses that have been eligible to do this all over again for year 2, and we have 16 that have completed their HealthLinks assessment, and we have 1 that is in progress or in the process of doing that. So really high retention rate. which to us is really exciting because it means that the businesses are enjoying the program so far and want to keep working with us. So we feel great about that. And also, I just wanted to give you all a flavor of what the leaders are saying about the Total Worker Health Leadership Program. So we recently did some interviews with some of the leaders we trained in our first cohort, and we had a few themes that I just wanted to highlight here. So one of them was that they were really enjoying and appreciating the support from us at the Center for Health, Work, and Environment. So that first quote shows how that particular leader was just really appreciative of the support and reminders that we were giving them in terms of their goals for total worker health. The next theme that popped out to me was that a lot of these businesses had never really thought to ask their employees for their input, or maybe weren't doing it in the most effective way. So that second quote, my biggest takeaway was learning how to evaluate what people are wanting in our organization. So we were able to help this leader realize how to engage with their employees through like a needs assessment or something like that. And then the last theme I wanted to highlight was that they really appreciated the collaboration with other organizations and leaders. So that third quote, being given the opportunity to collaborate with other businesses was the most valuable part of the program. The collaboration inspired much of the things we initiated this year. I just thought that was pretty cool because it is fun to be in the leadership training and see them, you know, bounce ideas off each other and really inspire one another. And these are, you know, businesses from all different kinds of industries. So that is pretty fun to see. So just to bring it back to our hypotheses.
Yeah, I wanted to tie it back to the ultimate goal of our study, because this is a research study. And just to note that through HealthLinks and our Total Worker Health Leadership Program, we are trying to help small enterprises undergo organizational change. We want them to develop their policies and programs, but we also want them to change their culture about how things are done in practice on a day-to-day basis. And we want them to develop more policies and programs as needed to strengthen their climates for safety and health. And we ultimately are very much interested in how all of this change impacts worker health risks, occupational injuries, and personal health.
And then for future directions, in terms of the research study itself, we are going to continue recruiting. I think we have about a year left in order to recruit. And then we will do our analyses and disseminate our results through peer-reviewed journals and other ways too, I'm sure. But we also are very big on research to practice, and so our Total Worker Health Leadership Program will be offered to non-study organizations eventually, and the Employee Health and Safety Culture Survey will soon be offered to non-study organizations through HealthLinks, so they can get it as part of their HealthLinks participation, which is an important update. So HealthLinks just this week launched a new website. We have expanded nationally, and the website is a more user-friendly interface, and we have a new structure to our plan, so businesses have more options. They can pick what they want to receive from HealthLinks rather than it just being everyone gets the same thing. And we are open to Canadian businesses. Just please be aware that the prices are listed in US dollars. So HealthLinks has gone national, and that is an exciting update that just happened this week for us. So if you want to stay connected with us, please do. This is our website and our Facebook page and our Twitter account. We try to be pretty active on social media. And so that is all we have for you. If there are questions, we can take them now.
Thank you, Erin and Natalie, for your presentation. To the audience, if you have any questions, right now would be a good time. You can enter them under the questions panel. So a few questions for you. What total work health interventions were the most successful?
So what total worker health were the most successful? So there have been a couple of meta-analyses that have talked about a variety of total worker health programs and the effectiveness of them. I would say that we're still building the evidence for what kinds of total worker health programs are the most effective. Our total worker health intervention will be able to specifically test things around whether if a business develops more worksite wellness policies at the detriment of safety policies, does that impact safety or vice versa? But other NIOSH Total Worker Health Centers of Excellence are testing a variety of different kinds of total worker health interventions. And if you go to their websites, you can read all about the different kinds of interventions that they're testing as well.
Thank you so much. And the other question was, can we get a copy of the study or any published research material?
Yes, we can. We just published earlier this year our sort of a whole framework and reasoning behind the study and describing the components of it, and I'm happy to share that link with anyone. But our study results, we're still collecting data, so we don't have anything to share quite yet.
But stay tuned.
Thank you, Erin and Natalie.